Well, it's all been leading to this. Welcome to Reframe the Future, a series in which we'll be publishing insightful interviews with changemakers right the way across the health landscape. Over the course of the series, we'll be discussing the future trends, the directions of travel for the industry, with those individuals who are genuinely making an impact. So for this inaugural episode, Josh and I are thrilled to be joined by Raquel Peck. Raquel, you are what the kids call today the OG of patient advocacy. You have roles including the chair of the International Experience Exchange with Patient Organisations, IEEPO. You're a consultant with the World Health Organization and ex-CEO of the World Hepatitis Alliance. How are you and how on earth do you fit all of that into your day?
Hi, Seb. No one ever introduced me as the OG before, so I guess thank you. I'm delighted to be here.
What we'd like to do with your help is look at the latest movements in patient advocacy, the growing areas of collaboration between pharma and patient groups, particularly putting a lens on breaking down the silos that exist to achieve the 2030 Sustainable Development Goals. 2022 is shaping up already to be a pivotal year for health policy change and driving towards a more humanised healthcare system.
There's no doubt about it. You've been incredibly busy launching all sorts of initiatives on behalf of patients globally, Raquel. Most recently, you've created a new movement called Humanising Healthcare. Can you talk to us a little bit about that and what it means and how it represents a shift in the current thinking?
Sure. So the IEEPO patient community has been drawing attention to this need to go beyond the disease. So beyond the symptoms, in a sense, beyond the literal definition of patient, and really start looking at the person as a whole. And the reason why this is so crucial is that if we don't factor in people's needs and people's circumstances, and here we're talking about physical, financial, social, cultural circumstances, even legal challenges, then we're going to be missing huge opportunities.
I think we've seen that healthcare has evolved so much more than just treating a disease. And as our knowledge of diseases evolves, so should our knowledge of the patient experience. And at Aurora, we're seeing more of our work with our clients now looking at working beyond the disease awareness campaigns, which are such a fundamental and important part of the work we do. But it's only the tip of the iceberg. And we can go further to address the societal issues that underpin the way in which people access healthcare. The question for you, Raquel, is what for you is the evolution of humanising healthcare and how does it differentiate from this patient centricity that we've spoken about in the industry for so long?
Now, that's a really good question. And I guess the difference here is that we are now applying a diversity, equity, and inclusion lens to patient centricity. So we're still very much saying patients should be at the center. That's absolutely certain. But we are adding important layers to this statement. So for instance, when companies tell me, oh, we put patients at the center of everything we do, my immediate reaction really is to challenge them and then to ask them, okay, what do you mean by that in practice? And you see that answers will vary, especially depending on where you are in the world, but also who are these patients that you're engaging with? Is it only like a privileged segment of the population that you're listening to? Whose voices are there on your table?
I just want to underscore your point about DE&I there, Raquel. Is this an example of where we're starting to see some really important change within the industry and how we look at creating opportunities to engage with communities of patients and people?
Yes, I would say that you have a definitely interplay here. So we have all seen how health is linked to many other societal pillars, and then what happens to those pillars when health is affected, right? So let's take awareness raising as an example, for instance. So that's incredibly important. But any effort on that front will only go so far unless the information that you're giving is the right information for your audience, but also if you're ensuring like the understanding of that information. And here we factor in the use of language, health literacy, and so on. Also, I must say that there's this new imperative that we all must abide by, which is meeting the patients where they are and not where you want them to be. So when you start thinking about this and also the humanizing aspect, then your awareness work takes a whole new dimension, a very much social impact dimension that you've just mentioned, Seb.
We're looking at kind of this humanising healthcare and thinking about the socioeconomic issues both nationally and globally. The holy grail, so to speak, is reaching these hard to reach patients. And these are the patients that aren't engaging with their healthcare. They're struggling to access healthcare services. They're not engaging through these typical channels. But what more can be done to reach these hard to reach communities? and to ensure their experiences are not only heard but acted upon.
Well, thank you, Josh. But I think that the question here is why we say these are hard to reach people, hard to reach communities in the first place, because this implies blame on the community themselves. So I'm here trying to reach you, but you're not there. I'm doing so well, right? So we really need to start challenging ourselves, our roles, and then looking at ways to engage with different communities. And a key factor here is to work with representatives of the communities we want to engage with, to listen to them, to build trusted relationships.
So Raquel, you've talked extensively there about access to health, but there's obviously another element here, which is prevention, because the longer we live in healthy life, the less we'll have to need to access those healthcare services. So what's going on with prevention at the moment? Is enough being done?
Oh, not nearly enough. Not nearly enough. If you think about this, okay, we have this huge focus on length of life, right? And we spend quite a lot of money on treatments that take place in the last months, the last days, sometimes even the last hours of someone's life. Now, just think what would happen if we spend the same amount of resources on that same very person, but much earlier, before they got ill, right? Surely that would have a much bigger impact on that individual, but also on society as a whole.
So, Raquel, where is demonstrable action of this starting to happen?
So let me take completely two different examples when we're talking about humanizing healthcare. If we look at Ramadan, which is being observed by so many people who practice Islam, well, this is a period where you fast for long hours. And here in England, we have some hospitals doing a wonderful job working with imams, but also with the British Islamic Medical Association in order to provide clear information on how to best navigate this month, including several exemptions allowed to fasting. For instance, if you need to ingest medicines or if you need to take your injections. So really, you're no longer just focusing on that medical chart in front of you, but you're looking at the person and thinking, okay, what happens to them once they're out of my clinic? Shifting gears, if you look at data sets that industry holds, so you note that these are predominantly built on data from white European descent, and that only allows you to, properly see a few differences. So what we are seeing now is just this big move to advance inclusive research. And that includes addressing barriers to clinical trial participation, increasing access to innovative diagnostic, but also therapeutic solutions, and so on. And in order to do that, guess what? You need to engage the community, to build trust, to listen, and ultimately to humanize approaches.
How realistic is it for entire healthcare systems to be able to look at individual patients or subgroups of patients when there are so many people going through these healthcare systems that are most of the time underfunded and understaffed?
Right, Josh, I think I'm going to be a politician here and throw the question back at you differently. But what happens if we don't look at that patient as an individual, right? What opportunities are we missing? Is this just like short-term goals that we are achieving here, really? These people might have to come back because we are not seeing all these other circumstances, or they might not be even assessing the right treatments in the first place. So I think really we need to start questioning ourselves here. We've seen what happened in COVID. We've seen what happened in different circumstances. So isn't it time to start trying something different here and really looking at the situation through different angles? We really believe that there is more to the patient. A patient is that person that is in front of your doctor in a clinical setting, but they are not a patient forever. Once the doctor opens the door and waves goodbye, their lives continue. And we need to factor that in. It's really, really key that we do so.
Because I guess that opens up another build in terms of working with the individual and hyperlocal community needs in terms of the Sustainable Development Goals. Because if there's one ethos around the SDGs for healthcare, it's leave no one behind. It's about universal health coverage, and we're only going to do that if we speak to individuals, hyperlocal communities, and work with them with the specific tailored needs and address societal barriers that are in their way. So where does the international community start in unpicking those learnings in terms of we've only got a short amount of time left to 2030, where do we start with those learnings, and how do we start to put tangible action plans to address them?
Yes, no, you're right. Like we had so many setbacks with COVID, and we will see, and actually are seeing a huge, well, a tsunami of collateral health damage, right? We have cancer control and prevention, disease elimination goals that will no longer be achieved, mental health, just to name a few. But that said, this was a time where walls were broken, a lot of collaboration happened, and then important concepts such as diversity, equity, and inclusion, prevention, the need to focus on and invest on workforce, the need to work with the communities. All those were brought to the forefront. And I very much believe that these are things that we advocates will need to really keep under the spotlight for as long as we can as we push through, these SDGs and like trajectories. These are absolutely key concepts that need to stay.
Just on that point, actually, so have you seen more examples of genuine co-creation from pharma and the healthcare industry coming through? Is that something you see that's gaining momentum? And I guess kind of a secondary question within that, when particularly pharmaceutical companies are coming to work with you in a genuine collaborative sense, is there a perception that actually if it's dealt with from a more senior level, for example, right the way up to the CEO, does that feel like a more genuine collaboration and a kind of more desired effort to genuinely engage with the community?
Yeah, I mean, like, there's definitely a momentum here, which is great. We've been fighting for that for so long. With like, when it comes to that, meaningful collaboration. But again, it really depends on where you are in the world. It really depends on the different actors here. But all in all, I think that, for instance, with IEEPO, this has been a fantastic example of patient organizations coming together, talking to industry. Here we're talking about one specifically, so I cannot talk on behalf of the other industry partners out there. But it's been a nice dialogue. So it's just like I hear what you have to say, now you hear what I have to say, and then we co-create, we build together, we come together, we discuss. And I think that that's what we need to have more of. That, like, we it's not, I think it's not enough just to say, here, come and have a seat on my table, but then you don't give the person the voice, right? So we have to go beyond that always. And I think that yeah, that's really the key. I see that happening more and more, but I'm always wary of buzzwords. Patient centricity was a buzzword for so many years, and now we're getting to a really good place. And I don't want the same to happen with co-creation in terms of like buzzwords.
We in this industry, we've been doing disease awareness campaigns, medical education activities since the dawn of time, and now there's an opportunity, and I think from the conversation today, a necessity to move beyond this and demonstrating societal impact in healthcare.
Absolutely. And I think you've touched on something really important there, Josh, because I think for us as agencies, social impact is often going to be the problem that sits behind the problem that's presented to us. So it really starts with defining that problem, in terms of understanding why access to health services for sometimes very specific communities of people or patients is low, whether that's hyperlocal within a country or at a broader international level. And really, these campaigns run all the way through to measuring them differently. We can move beyond some of the more superficial, dare I say, vanity metrics like video views and coverage impressions, and look at more in-depth qualitative and quantitative benchmarking. Did we shift the needle for this community? Did we improve access? Did we lower that societal barrier?
Can I just add like a one, like two, no, 1 cent, not 2 cents, 1 cent. But also, like, if you're talking about awareness campaigns, and I mentioned that earlier, a, a very important thing is how you are ensuring understanding of the information that you're giving. Because one thing is to give the information, to give out the content. Okay, but how do you ensure that there's understanding of that information? That's a whole new, like you're opening the door to a whole new, range of possibilities there, and challenges, I'd say, as well.
Absolutely, and I think the measurement is the key piece, isn't it? Because if we don't measure it, we can't measure the progress, and we can't iterate and learn and build better programs based on what we've done and what we're doing. So I guess, Raquel, thank you so much. Keep fighting that good fight and doing everything that you do on behalf of patients all around the world, and the community groups that you represent. We're indebted for your time today, so thank you so much.
Thank you for having me here. It's been a pleasure.